A young woman accidentally pushed her hand through a glass door and bled profusely from a superficial laceration on the anterior aspect of her wrist. She had sensory loss over the palmar aspect of the medial 1½ fingers. She was unable to grip a piece of paper between her left ring and middle fingers, but all the long flexors were intact. Which artery and nerve were cut in the accident? This seems like a fairly involved question with a lot of things to think through. All that you really need to focus in on at first is that she's on the anterior aspect of her left wrist, and she has 1½ fingers affected, which means she's on the ulnar side. And once you determine that, you have a fairly hard time ruling out something that has ulnar in it. And the other principle that you need to bring to a question like this is the basics. And one of the basic foundations that we know is that arteries tend to run with nerves of the same name. So if you're looking at option A, you have radial artery and radial nerve, which are running together, but they're on the wrong side. If you're looking at ulnar artery and median nerve, well, those are two different things that are running together, so that certainly would be less likely, even if you didn't know the detail. The answer here is going to be the ulnar artery and the ulnar nerve, because they're on the right side and they're running together. If you look at the other option in D, radial artery and ulnar nerve, again, they're not on the same side as one another. And then if you look at the anterior interosseous artery and radial nerve, one is in the flexor compartment and the radial nerve is in the extensor compartment. Again, they don't run together. So it would be very difficult to have those cut in a single incident unless they were pretty incredible incidents, so you'd need a magic bullet. A 52-year-old woman is diagnosed with breast cancer with a tumor located in the lateral inferior quadrant of the left breast. Into which nodes will most of the lymph from the breast initially drain? And the answer is anterior. Because of the prominence of breast cancer, it's not uncommon to get a question that deals with the lymphatics in the axilla, which is where 3/4 of the breast drainage is going to be draining into. These lymph nodes that are draining the upper limb are going to be tied together with the thoracic wall lymph nodes. They're basically named by position. So the anterior pectoral nodes can actually be called pectorals, and the posterior can be called the subscapular or scapular nodes. Then we have the central, and then on either side of the centrals we have laterals, which would be more distal, and the apicals, which would be up the chain further near the clavicle. The anterior nodes will be the sentinel nodes in most of the drainage of the breast, because 3/4 of that breast will drain there. The parasternals will drain the more medial components of the breast.